Good morning. I am Reema Stanley, tutor at Triple M College of Nursing, Department of Mental Health. In this video, I'll be discussing with you about nursing care of patients with anxiety disorder. Let us see what is anxiety. Anxiety is a normal phenomenon which is characterized by a state of apprehension or uneasiness arising out of anticipation of danger. Normal anxiety, however, becomes pathological when it causes significant subjective distress and impairment of functioning of the individual. Let us see what is anxiety disorder. It is an abnormal state in which the most striking features are mental and physical symptoms of anxiety, which are not caused by organic brain disease or any other psychiatric disorder. Here are the common anxiety disorder: phobic anxiety disorder, panic disorder, generalized anxiety disorder. Let us see what is phobic anxiety disorder. It is a disorder in which the individual experiences intermittent anxiety which arises in a particular circumstances, that is, in response to the phobic object or situation. Here are some of the examples of phobic anxiety disorder: simple phobia, social phobia, agoraphobia. Simple phobia is otherwise called a specific phobia. It is an irrational fear of a specific object or stimulus. For example, fear of height, which is called as acrophobia. Social phobia is an irrational fear of performing activities in the presence of other people or interacting with others. Agoraphobia is characterized by an irrational fear of being in a place away from the familiar setting of home, in crowds, or in situations that a patient cannot leave easily. Panic disorder is characterized by anxiety, which is intermittent and unrelated to a particular circumstances. Unlike phobic anxiety disorder, where anxiety is intermittent and occurs only in a particular situation. Generalized anxiety disorder are those in which anxiety is unvarying and persistent. Now let us see nursing management of patient with anxiety disorder. This include a complete history collection and also a pre-morbid history of the patient. Do a complete mental status examination. This will help to identify the patient's problem and plan for the nursing care. Here are the possible nursing diagnoses for patient with anxiety disorder: fear related to a specific stimulus, evidenced by avoidance of feared object; social isolation related to fear of being in an unfamiliar place, evidenced by staying at home and refusal to leave the room; panic anxiety related to real or perceived threat to biological integrity or self-concept, evidenced by physical and physiological symptoms; powerlessness related to impaired cognition, evidenced by verbal expression of lack of control over life situation; or non-participation in decision making related to own care or life issues; ineffective individual coping related to underdeveloped ego or avoidance of phobic stimulus, evidenced by physical and physiological symptoms of anxiety; impaired role performance related to avoidance behavior, evidenced by inability to fulfill usual patterns of responsibility. Now let us see nursing intervention to reduce anxious behavior. Reassure the patient that he is safe, because at the panic level of anxiety, the patient may fear for his own life. Allow the patient to verbalize feelings, because this will help to explore the patient's perception of the threat to physical integrity or threat to self-concept. Include the patient in decision making related to selection of alternative coping strategies. For example, patient may choose either to avoid the phobic stimulus or attempt to eliminate the fear associated with it. If the patient chooses or selects to work on eliminating the fear, teach the patient techniques of desensitization. Encourage the patient to explore underlying feelings that may be contributing to irrational fears. Nursing intervention to reduce social isolation behavior in anxious patients. Convey an accepting attitude and unconditional positive regards. Make a brief, frequent contacts, be honest, and keep all promises. This intervention will increase feeling of self-worth and facilitate a trusting relationship. Attend group activities with the patient that may be frightening for him. Administer anti-anxiety medications as ordered by the physician. Also monitor for effectiveness and side effects. Discuss with the patient the signs and symptoms of increasing anxiety and teach techniques to reduce them. For example, relaxation exercises and thought stopping. Give recognition and positive reinforcement for voluntary interaction with others. Nursing intervention to reduce panic anxiety. Stay with the patient and reassure of safety and security. Maintain a calm and non-threatening approach. Use simple words and brief messages. Speak calmly and clearly to explain hospital experiences. Keep the environmental stimuli as low as possible, such as dim lighting and limiting the people. Administer tranquilizer medication as prescribed by the physician. When the level of anxiety has been reduced, explore possible reasons for occurrence of the anxiety, as recognizing a precipitating factor is the first step in teaching the patient to interrupt escalating anxiety. Teach the patient the signs and symptoms of anxiety and ways to interrupt through progression of relaxation techniques, deep breathing exercises, meditation, physical exercises like brisk walking or jogging. Nursing intervention to improve self-control in anxious patient. Allow the patient to take as much responsibility as possible for self-care activities. Provide positive feedbacks for decision making. This will help to increase patient's feeling of control. Assist the patient to set realistic goals, as unrealistic goals will only cause failure and feeling of powerlessness. Help the patient to identify life situations that are within the patient's control. Also help the patient to identify areas of life situations that are not within his ability to control and encourage patients to verbalize feelings related to this inability. This will help to deal with unresolved issues and accept what cannot be changed. Now let us see nursing intervention to improve coping. Work with the patient to determine the types of situation that increases anxiety. Initially, meet the patient's dependency needs. Encourage the patient to be independent and give positive reinforcement for independent behavior at a later stage. Help the patient learn ways of interrupting anxiety situation through techniques such as thought stopping, relaxation, role modeling, assertive training, etc. Support the patient's effort to explore the meaning and the purpose of those adaptive behavior. Provide the patient with structured schedule of activities for patient, as structured activities will provide a feeling of security for anxious patient. Now let us see nursing intervention to improve role performance. Determine the patient's previous role within the family and the extent to which this role is altered by the illness. Also identify the roles of other family members. This will provide data to plan an appropriate care. Encourage the patient to discuss conflicts evidence within the family system and identify how patients and other family members have responded to this conflict. Explore available options for changes or adjustment in role and practice them through role play, as planning and rehearsal will help to reduce anxiety. Give patients a lot of positive reinforcement for ability to resume role responsibilities, as this enhances self-esteem and promotes repetition of desired behavior. So in this video, we have discussed about various nursing care and nursing intervention for patients with anxiety disorder. Thank you.